Hi, I'm Dr. A P Nirmal Raj. I've done my specialty in prosthodontics and I'm practicing at Premia Dental Care, which is at Nandi Durga Road. Many times patients come to us saying that I have gaps between my teeth and I need them to be closed. There are various options that we have as a treatment for the patient. So if let us say that we can go in for an orthodontic treatment, if the gaps are too big, then we can go for an ortho treatment wherein we can correct them by an orthodontic treatment. If the patient says that is not willing for an orthodontic treatment, then what are the various other treatment options that we have? Then what we need to do is we need to first make an impression, do a mock-up preparation, and then have what is known as, you can do it with your wax, you can have it as a diagnostic waxup and show the patient the various width of each teeth. The width of each teeth is going to be increased so that the gaps are mildly closed, and then if the patient is once happy, then you can go forward with the various options. The first option would be, I would recommend laminate. You can give a laminate veneer, but as long as the gaps are not too big, because the laminate veneer will not stand in unsupported areas, it can break off. If there is a lot of unsupported area, then go for a crown. If not, you can just go forward with your laminate veneers, which are very superior form of treatment. If the gap is too much, then go for your all ceramic crowns, which are also highly aesthetics, wherein you need to prepare the teeth and make sure that the margins are very well adapted, and then you can go close all the gaps between the teeth. Or let us say, there are patients who may not be able to pay for the porcelain laminates or the all ceramic crowns. Then you can also go in for closing the gaps with our composite resins. But the only problem that I see with composite resins would be the staining of the composite. Over a period of time, the composite resin can stain, but that can be corrected off, and if you polish it well, then the staining portion can be actually taken care of. So these are the various options that I would suggest. If the gap is very small, you can think for a composite resin, or if the patient can afford, then you can go for a porcelain laminate. If the gap is pretty much big, I would say orthodontic treatment is a good form of treatment, but if the patient is not willing for an ortho treatment, then you can think of crowns that can be placed, an all ceramic crown can be placed, so that there's metal free and you will have good aesthetics. Especially with metal, you have what is known as greening of porcelain, wherein you can find that the margins over a period of time will appear dark in color. But whereas in all ceramic crowns, all those things are not there, it's metal free, and the patient would feel very happy about the aesthetics. And you can go for a subgingival margin in case of anterior teeth, so that you increase the aesthetics. Thank you.